Don't stop. Don't stop.
Gestational diabetes. What is gestational diabetes? Gestational diabetes that develops during pregnancy is a relatively common complication of pregnancy, affecting about 4% of all pregnant women. Risk factors of developing gestational diabetes: if you, 1. are obese when you become pregnant. 2. have high blood pressure or other medical complications. 3. have given birth to a large, greater than 9 pounds, baby before. 4. have given birth to a baby that was stillborn or suffering from certain birth defects. 5. have had gestational diabetes in previous pregnancies. 6. have a family history of diabetes. 7. come from certain ethnic backgrounds, including African, Hispanic, Asian, Native American, or Pacific Islander. 8. are older than 30, but half of women who develop gestational diabetes have no risk factors. What causes gestational diabetes? Gestational diabetes is the result of changes that occur in all women during pregnancy. 1. increased levels of certain hormones, including cortisol, estrogen, and human placental lactogen, can interfere with your body's ability to manage blood sugar. 2. this condition is called insulin resistance. 3. usually your pancreas, the organ that produces insulin, is able to compensate for insulin resistance by increasing insulin production to about 3 times the normal amount. 4. if your pancreas cannot sufficiently increase insulin production to overcome the effect of the increased hormones, your blood sugar levels will rise and cause gestational diabetes. Complications: if left untreated, gestational diabetes can cause serious complications for your newborn. For example, 1. babies grow too large, called macrosomia, increasing the risk of problems during delivery, such as injuries to the baby's shoulders and arms and nerves in these areas. 2. having a very large baby may also increase your risk for requiring a cesarean section or other assistance during delivery, such as a forceps or vacuum delivery. 3. your baby may also experience a sudden drop in blood sugar after birth, requiring treatment with a sugar solution given through a needle in the vein. 4. your newborn baby may also have a higher risk of developing jaundice, a condition that causes yellowing of the skin and whites of the eyes, and breathing problems. 5. the risk of birth defects in infants whose mothers have gestational diabetes is very low because most pregnant women develop gestational diabetes after the 20th week of pregnancy, when the fetus has already fully developed. 6. the risk of birth defects increases only if you had undiagnosed diabetes before pregnancy or if you have high, out of control blood sugar levels during the first 6 to 8 weeks of pregnancy. 7. if you have gestational diabetes, your baby doesn't have an increased risk of developing type 1 diabetes during childhood. 8. however, your child is more likely to develop type 2 diabetes later in life as well as be overweight throughout life. Most women's blood sugar levels return to normal after delivery. 9. however, once you've had gestational diabetes, you are more likely to develop gestational diabetes again during subsequent pregnancies. 10. you also have an increased risk of developing diabetes later in life. 11. women with gestational diabetes have a 50% chance of developing diabetes within 10 to 20 years of delivery. If you have gestational diabetes, the chances of having problems with the pregnancy can be reduced by controlling your blood sugar, glucose, levels. You'll also need to be more closely monitored during pregnancy and labor to check if treatment is working and for any problems. Checking your blood sugar level: you'll be given a testing kit that you can use to check your blood sugar level. This involves using a finger pricking device and putting a drop of blood on a testing strip. You'll be advised how to test your blood sugar level correctly. When and how often to test your blood sugar: most women with gestational diabetes are advised to test before breakfast and 1 hour after each meal. What level you should be aiming for: this will be a measurement given in millimoles of glucose per liter of blood, mol/L. A healthy diet. Making changes to your diet can help control your blood sugar levels. You should be referred to a dietitian, who can give you advice about your diet and how to plan healthy meals. You may be advised to eat regularly, usually 3 meals a day, and avoid skipping meals. Eat starchy and low glycemic index (GI) foods that release sugar slowly, such as whole wheat pasta, brown rice, granary bread, all-bran cereals, pulses, beans, lentils, muesli and plain porridge. Eat plenty of fruit and vegetables, aim for at least 5 portions a day. Avoid sugary foods. You do not need a completely sugar-free diet, but swap snacks such as cakes and biscuits for healthier alternatives such as fruit, nuts, and seeds. Avoid sugary drinks. Diet or sugar-free drinks are better than sugary versions. Fruit juices and smoothies can also be high in sugar, and so can some no added sugar drinks, so check the nutrition label or ask your healthcare team. Eat lean sources of protein, such as fish. It's also important to be aware of foods to avoid during pregnancy, such as certain types of fish and cheese. Exercise. Physical activity lowers your blood glucose level, so regular exercise can be an effective way to manage gestational diabetes. You'll be advised about safe ways to exercise during pregnancy. Find out more about exercise in pregnancy. A common recommendation is to aim for at least 150 minutes, 2 hours and 30 minutes, of moderate intensity activity a week, plus strength exercises on 2 or more days a week. Medicine. You may be given medicine if your blood sugar levels are still not well controlled 1 to 2 weeks after changing your diet and exercising regularly, or if your blood sugar level is very high. This may be tablets, usually metformin, or insulin injections. Your blood sugar levels can increase as your pregnancy progresses, so even if they are well controlled at first, you may need to take medicine later in pregnancy. You can usually stop taking these medicines after you give birth. Tablets. Metformin is taken as a tablet up to 3 times a day, usually with or after meals. Side effects of metformin can include feeling sick, being sick, stomach cramps, diarrhea, loss of appetite. Occasionally a different tablet called glibenclamide, Deanil, may be prescribed. Insulin injections. Insulin may be recommended if you cannot take metformin or it causes side effects. Your blood sugar levels aren't controlled with metformin. You have very high blood sugar. Your baby is very large or you have too much fluid in your womb, polyhydramnios. Insulin is taken as an injection, which you'll be shown how to do yourself. Depending on the type of insulin you're prescribed, you may need to inject yourself before meals, at bedtime, or on waking. You will be told how much insulin to take. Blood sugar levels usually increase as pregnancy progresses, so your insulin dose may need to be increased over time. Insulin can cause your blood sugar to fall too low, hypoglycemia. Symptoms of low blood sugar include feeling shaky, sweaty, hungry, turning pale, or finding it difficult to concentrate. If this happens, you should test your blood sugar, treat it straight away if it's low. Find out how to treat low blood sugar. You'll be given information about hypoglycemia if you're prescribed insulin. Monitoring your pregnancy. Gestational diabetes can increase the risk of your baby developing problems, such as growing larger than usual. Because of this, you'll be offered extra antenatal appointments so your baby can be monitored. Appointments you should be offered include an ultrasound scan at around week 18 to 20 of your pregnancy to check your baby for abnormalities. Ultrasound scans at week 28, 32, and 36, to monitor your baby's growth and the amount of amniotic fluid, plus regular checks from week 38 onwards. Giving birth. The ideal time to give birth if you have gestational diabetes is usually around weeks 38 to 40. If your blood sugar is within normal levels and there are no concerns about your or your baby's health, you may be able to wait for labor to start naturally. However, you'll usually be offered induction of labor or a cesarean section if you have not given birth by 40 weeks and 6 days. Earlier delivery may be recommended if there are concerns about your or your baby's health, or if your blood sugar levels have not been well controlled. You should give birth at a hospital where specially trained healthcare professionals are available to provide appropriate care for your baby. When you go into hospital to give birth, take your blood sugar testing kit with you, plus any medicines you're taking. Usually you should keep testing your blood sugar and taking your medicines until you're in established labor or you're told to stop eating before a cesarean section. During labor and delivery, your blood sugar will be monitored and kept under control. You may need to have insulin given to you through a drip, to control your blood sugar levels. After birth, you can usually see, hold, and feed your baby soon after you've given birth. It's important to feed your baby as soon as possible after birth, within 30 minutes, and then at frequent intervals, every 2 to 3 hours, until your baby's blood sugar levels are stable. Your baby's blood sugar level will be tested starting 2 to 4 hours after birth. If it's low, your baby may need to be temporarily fed through a tube or a drip. If your baby is unwell or needs close monitoring, they may be looked after in a specialist neonatal unit. Any medicines you were taking to control your blood sugar will usually be stopped after you give birth. You'll usually be advised to keep checking your blood sugar for 1 or 2 days after you give birth. If you're both well, you and your baby will normally be able to go home after 24 hours. You should have a blood test to check for diabetes 6 to 13 weeks after giving birth.